Mental health care has gone under significant changes throughout history, from the overcrowded but isolating insane asylums to the comparably more peaceful and effective community-based care services. In this video, we'll explore the tragic history of asylums and the journey to deinstitutionalization that also reflects society's evolving understanding of mental illness. We'll cover the most infamous insane asylums and how their legacy affects modern mental health care practices. The first asylums were tasked with taking the mentally ill away from society and hiding them, rather than actually treating them. The ill were often chained up and kept in small dungeons with no windows. The first and probably most infamous example of an institution for the mentally ill is the Bethlehem Royal Hospital in Bromley, London. Originally founded in 1247 as the Priory of St. Mary of Bethlehem, the institution's original purpose was to heal sick paupers. It is unknown when the mentally ill began occupying the hospital, but by 1403, the majority of the residents at the Bethlehem were lunatic patients, and thus the first mental institution was born. Nicknamed the Bedlam, the reputation of the Bethlehem was so infamous that the word Bedlam also carries the definition of a scene of uproar and confusion. Some of the bizarre treatments at the Bedlam include cold water therapy, bloodletting, and rotational therapy. Danvers State Hospital, located in Danvers, Massachusetts, is one of the most brutal insane asylums in history. Danvers is largely regarded as the birthplace of the frontal lobotomy, the first of which was performed in 1948, according to the Danvers State Hospital website. Also practiced at Danvers was electroshock therapy and the use of straitjackets to restrain patients. The facility began to close down in the 60s due to massive budget cuts and the deinstitutionalization movement. By the early 90s, the entire facility was shut down. The lobotomy process includes jamming an instrument, often resembling an ice pick, into the patient's eye socket to sever connections within the frontal lobe of the brain. According to a study done in 1984 by Dr. Anastasia Kucharski, symptoms of lobotomies are boasting, self-aggrandizement, hostility and aggressiveness, distractibility, flight of ideas, euphoria, lack of initiative, impaired short-term memory, and impaired social sense. According to an article by Mayo Clinic, electroshock therapy, also known as electroconvulsive therapy or ECT, is a procedure in which small electric currents pass through the brain, intentionally causing a brief seizure. ECT changes the brain's chemistry and can sometimes improve symptoms of certain mental health conditions. It is still used in rare cases today, but the reason it was so brutal in the early days of mental health treatment was due to the fact that the high doses of electricity were given without any medicine or general anesthesia, which led to greater pain, more fear and anxiety, and a worsened mental state. Deinstitutionalization is the process of removing patients from state institutions and closing down said institutions. Deinstitutionalization began in the 1950s after the invention of chlorpromazine, commonly known as Thorazine, the first effective antipsychotic medication. The final closures of state institutions were in the 90s, but this did not put an end to the suffering of the mentally ill. Asylums have been replaced with psychiatric centers and community centers focused on short-term care. While considerably better than institutions of the past, these institutions, however, are poorly funded and not well equipped to handle mental illness. Due to the failings of these community centers, the seriously ill now end up in jails or homeless rather than getting the care that they need. Although we have the resources to help the mentally ill with the inventions of new medications and therapeutic processes, often the people who need it most are last in line. At this point in time, it is not a lack of understanding keeping us from treating the mentally ill, but a fatal flaw in the system. The mentally ill cannot afford the resources that they need, or the resources that are available lack the funding necessary to provide full recovery.